So today we're going to talk about CallMyDoc. CallMyDoc was created because having to deal with many different phone calls is extremely difficult. There's a variety of reasons for it, which we'll explain as we go through this. Basically, CallMyDoc can be configured as we go through this. Just think out of the box. Don't worry about if we can do it, because we're in hundreds of practices and locations. So at the end of the day, this system can be configured in a variety of different ways to handle phone calls after hours or during the day or both. And that's what we're going to explain here. So first of all, we've been doing this for a while. We've been with Athena probably about 7 years. We currently handle 450,000 patient calls a month, and we've done 14 million patient calls to date. The way things are, period, and this didn't really change much over the time we've been doing this, is the fact of the matter is 80% of all communications to any practice in the United States are something to do with the phone. And that's just how it is. We can introduce lots of different things, people try to get people to use the patient portal, et cetera, et cetera, et cetera. At the end of the day, people are just going to pick the phone up and call, because that's just how things are, period. Now, the second thing is that if you get a high volume of phone calls, how do you figure out which ones are the most important to deal with and which ones can wait? That's one issue. Another issue is if you have a high volume of phone calls and a stat lab result goes into a voicemail at 4:55 on a Friday evening, does anybody know about that stat lab result until Monday morning? There's a variety of what I would call open loops or holes in the phone communications environment in most practices that we plug all of them. Now, here's the other funny thing about this, which is pretty amazing, but it's the way it is, okay? The way it works now is somebody's calling you, and when the person that's calling you probably exists in your patient charts already. But because your patient charts are not connected to your phone system, you have to do a lot of manual labor and typing things in and looking up the chart and listening to voicemails, doing all kinds of crazy stuff that just totally waste your time. So what we're doing is we're using our system to bridge the gap between the phone system and patient cases. So a message can go right from a patient's mouth directly into a patient case, and when it hits Athena, automatically goes where it's supposed to go to the person that can work on that particular question. So instead of having to listen to 30 or 40 or 50 or 500 voicemails at the end of the day, you don't. You just read the stuff that's coming in. And we're going to talk about that, and I'll show you examples. This is just another little bit about us. Again, you need to think of this as a toolkit that can be configured in a variety of different ways. As a matter of fact, the best way to think about it is use CallMyDoc to focus on the worst phone problems that you have, because that's what it excels at. So what is CallMyDoc doing? And again, we're going to demo this in just a minute. CallMyDoc is set up with different phone numbers. So the way that works is that you get as many phone numbers as you want. Each phone number is connected to the charts. Each phone number is configured to do something different. We do not charge by the phone number. We don't charge by the number of phone calls. We have an extremely simple pricing plan. And we also don't charge to set all this stuff up. All of the phone numbers can be customized to do exactly what you want. All the phone numbers know how to transcribe patient questions and other caller questions directly into patient cases. And when it transcribes it at 99% accuracy. So it's not like other systems where you can't really figure out what the hell they're talking about. when we do the demo, you'll see that the transcriptions are almost perfect. The other thing that we also can do, it's not on this slide, is we support 15 different languages, and we can convert from Spanish or some other language, Arabic, French, whatever. But when we transcribe it, it's transcribed into English. So that's another thing that can help to manage all the different types of calls that you need to take care of. Plus, lastly, every single phone call is tracked until it's finished. We have a dashboard that shows you exactly what's going on all the time with every single phone call CallMyDoc handles. Now, when it comes to setting up and configuring the system as an after-hours answering service, basically there's an app. The app actually can be used by anybody, and I'll explain reasons why that is, but the app is connected to the charts and to CallMyDoc. And so what happens is it self-documents every call after hours. So instead of having to remember to write a bunch of stuff down, it's all documented. It's extremely inefficient. It's extremely inexpensive, and everything is documented back to the charts the way it's supposed to. Now, this is something I'm going to reinforce later, but basically the way our system works is that because it's making everybody so much more efficient, either after hours or during the day, that this is measured from the time that we transcribe a message into a patient case to when it's closed out in Athena. And I could show you site after site, but the short answer is average call return time is going to be 2 hours for any type of call. And if you added up all those bars, they're bigger than the other bars at the bottom. So in general, all calls are getting handled in less than 8 hours a day. I'll just skip that. So what's going to happen is that when a call comes into the app after hours, the provider is going to see the patient demographics. They're going to see the 3 most recent lab results. In other words, if the provider has never seen this patient before, they're going to get a heads-up view of what's been happening with this patient lately so that they don't get any surprises. And the app has also the ability to call the patient back on its own or do refills and other types of automated functions, which also reduce the amount of time it takes to handle an after-hours phone call. So what you're going to find out is your response time to after-hours calls goes up. Now, what I'm going to do here to make this simpler is I'm going to switch to a live demo because it's going to be much easier to explain this live as a demo versus the other pieces we're talking about. So what I'm going to do is I'm going to call this phone number. Now, this phone number just happens to be set up a certain way. As I mentioned before, you can have as many phone numbers as you want. Every phone number is connected to the charts, and every phone number can be given a personality, if you will, that basically allows it to handle phone calls in a variety of different ways. So I have my app here. Now I'm going to start with the after hours piece because there's a lot of overlap between that and the daytime piece. But you'll see how those pieces fit together as we go along with this. So let me call that number and pretend I'm a patient. And I'll explain what's going on, what's happening in the background as we go along here.
Press 1 for English. Presione 2 para español. Please select one of the following. Press 1 for Sphinx Medical Tech. You have reached Athenahealth Test Office. The office is currently closed. If this is a medical emergency, please call 911 or go to the nearest emergency room. Otherwise, please listen to the following options carefully. If you are a provider or calling from a hospital or an emergency room or have urgent lab results, press 1. For established patients or calling on behalf of an established patient, press 2. If you are calling from a pharmacy, press 3. If you would like to be a new patient of our practice, or would like to leave us a general message, press 4.
I'm going to press
To
2.
receive a text, please enter the patient's date of birth by using your keypad to enter 2 digits for the month, 2 digits for the day, and 4 digits for the year of the patient. You have entered September 18th, 1963. Please wait while we look up the medical chart for the patient. If you have a question about your bill, labs, insurance, or some other message for our office, press 1. If you have a question about your schedule or to request or cancel an appointment or get directions to your next appointment, press 2. If you have an urgent issue and need to speak with the provider on call, press 3.
I'm going to press 3. That'll explain more what's happening here in the background.
Would you like us to return your call to 310-402-5573? If yes, press 1. Please speak the patient's first and last name. When done, press any key. Then you will be asked for more information.
Carl Silva.
Now, please leave a detailed message with as much information as possible as to why you are calling, any symptoms you are experiencing, and any other information that would help us expedite this call. Once you are done with your message, you can hang up and the office will return your call as soon as possible.
Okay, so right now it's listening to me. Everything you heard up to this point can be changed or customized to do anything that you want. What this is going to do is it's going to push a patient case with this transcription of what I'm saying right now, plus my chart and the transcription to the app. And we'll look at both of those in just a second.
Once the provider or office has listened to your message, we will contact you at.
There it is. Okay. So first, let's talk about what happened. So you get your CallMyDoc number or numbers. Again, you can have as many numbers as you want. Let's just say that it's after hours. So you forward your calls to it like you would any other after hours answering service. The on-call schedule can also be built in here, and it literally takes just a couple of minutes to put any on-call schedule in. When patients call in, they're going to use their date of birth to authenticate who they are to the system, because that's the way it has to be. In other words, if I called one of your practices during the day and whoever picks up the phone to answer my question, they're going to have to ask me for my date of birth. We just do the same thing. I can guarantee you 100% if you could use this tonight or tomorrow, whenever, your patients would just start using it. There's no patient training involved here. It's simply, I have a phone, remember when I was born, etc. If there's more than one chart, we would also ask for the first 3 letters of the patient's last name or other types of criteria. But as I mentioned before, we handle 450,000 patient calls a month, and it just works. We can always identify exactly who the patient is, no matter what. Now, in this demo, or this configuration of this particular demo, there's 3 things I can do. Now, the first thing is, I have a non-urgent question for the practice. And this is where the overlap comes with the daytime piece to a certain extent. So in other words, if I need a refill or I have a billing question or I need an appointment, etc., these are all the different patient case types that are supported in Athena. Okay. So in other words, every phone number understands how to transcribe into a patient case type or multiple patient case types, depending on how you'd like it configured. And the idea being that, again, a question or a problem goes right from the patient's mouth or the caller who's calling directly into a patient case. Because when people call in your office, they're not calling for a cheeseburger. I mean, they're literally calling for the same types of things over and over and over again. So this completely streamlines your workflow, whether it's being used during the day or after hours. Now, another big category, and we split this out separately, is scheduling and appointments. Usually it's, for any practice in the United States, it's one of the biggest, if not the biggest, question types that comes in. When's my appointment? I need an appointment, et cetera, et cetera. So we can do multiple things here. If you have the ability, or if you've turned on the Athenahealth patient portal to allow patients to schedule their own appointments, What we can do is present that over the phone and allow people to schedule different appointment types any way that they want. But it's completely different than the patient portal because we have the ability to mix and match different types of appointments with different phone numbers. So at the end of the day, it's totally streamlined. The patients are booking their appointments using their date of birth, etc. Now, if you don't have that, we can also transcribe an appointment request directly into a patient case type in Athena. In any event, another scheduling function we can handle automatically is canceling of appointments, and it will cancel the appointment in real time like a person does. But if you have a 24-hour cancellation policy and I try to cancel a half hour ahead of time, it'll say, I'm sorry, we can't cancel that appointment right now. Call the office back directly. Also, cancellations can be set to produce patient cases. In other words, if somebody cancels, they could say they need to reschedule, et cetera, et cetera. Then the last thing we can do under scheduling question types is if somebody forgot when their appointment is, we could send them a text or an email. And not only do we send them a text or an email with all their appointment information in it, but there's also a hot link they can click on, and Google Maps will give them step-by-step directions how to get to their appointment. Now, since this is the after hours demo or the on-call demo, there's also the app is involved too. Now, this used to be primarily a discussion around after hours answering services, but quite frankly, people use this app 24 hours a day, both the staff and the providers, because it has a lot of uses if you're not in the office or you can't get to the office for some reason. How I get notified, when I get notified, and for what types of phone calls I get notified is totally customizable. So I open my app and click on the call, and this information is coming out of the chart in real time. And we haven't done anything extra to speed this up. This is exactly how it appears and how it works if you're dealing with phone calls from the app, such as after hours. You immediately get, who is this person? What do they want to talk to me about? So it's completely different than any other after hours answering service, which is just a call out of nowhere. You never know what's going to happen to you. This allows you to screen your calls and have a look at, okay, what's happening? Who is this person, et cetera, et cetera. And then the next thing you do is that you can either swipe the screen or you can click on records below. And this will show you the 3 most recent visit summary, allergies, medications, and lab results. And not only does it render the lab results on this screen here, but I could zoom into it if I needed to. And if I needed to, I could print it on a wireless printer at home or wherever before I call this person back. Whoops, it shrunk down. I don't know why it does that. Hang on a second. There we go. Okay. And then you either have to swipe the screen again or you click on respond, and you always have to hit take session. Now you do that because that is part of the self-documentation that the app is going to do when we're finished with this call. And I'll show you where everything is going at the same time within that, but everything between take session and close session is documented, is measured, and there's a variety of different things that it can do. Now, if I want to call the patient back, I hit that phone icon and I'd hit that top green bar. Now, this is showing you 3 other phone numbers. The ones at the bottom are the ones that are on the patient's chart. The top one is the one they left. Remember when I called in, it said, do you want us to call you back at blah, blah, blah? That's the one I left, because what will happen is if you've been seeing a patient for a while, or they'll go out and they'll change their phone number or get a new cell phone or who knows what, move, they never tell the front desk. So what will happen is over time, the phone number they want to get called back on may not have anything to do with the chart, or maybe their battery ran out, whatever. But if I hit this top button or any of these other green buttons, it's going to set up a real-time conference call between me and the patient.
Connecting you with the caller.
And now my patient phone is ringing, and this would ring with the caller ID of your practice.
Hello, this is Athenahealth test office calling you back.
And they were connected. Okay, super. That's one thing that it can do. But as I mentioned before, there's a bunch of other things that it can do. If I click on add response, these are all the things the app can do on its own. Call the patient back, do a refill, do whatever, and I don't have to call anybody back necessarily. So this is just another reason why people might use this during the day, just because it's so easy. So let me click on prescribe. Let's say this patient called about some sort of refill. This is going to send a prescription to the pharmacy. Then it's going to update the chart, and it's going to call the patient to tell them where to pick this up all by itself. I'm also going to have it call the patient to tell them something. I sent in your refill, but we haven't seen you in a really long time. So when you get a chance, could you please set up the time to do a medication review? Okay, super. Now, this little box at the bottom, that doesn't go back to the patient. That's to take notes about the call. Anything that needs to be documented back to the chart. It's also going to go back into the patient case, which I'll show you in a minute. So I'm going to leave a note for the staff here. I sent in this patient's refill, but we haven't seen them in a really long time. So when you get in on Monday, could you please schedule a time for them to do a medication review? And then always remember, you have to hit close session, and then the app's going to do everything I told it to do, like this. Hello?
Hello, this is the office of Athenahealth test office. A message is waiting for you. Press any key to hear the message now. Hello, this is Athenahealth test office returning your call. A patient at this phone number contacted us with a medical issue. We are calling back now with the provider's answer. If you are the patient or a HIPAA authorized individual, press 1. To place Athenahealth test office has the following information for you. You can repeat this information at any time by pressing 1. Please listen to the entire message. This message has 2 parts. Part 1. The provider has prescribed the following medicine. Tazarac 0.1% topical cream. Every day by topical route. The prescription has been sent to the pharmacy. CVS 16050 in Target. Located at 3433 Sepulveda Boulevard. If you would like to confirm it is available at the pharmacy, you can call them at 310-370-1021. Please note that depending on the type of prescription, the prescription order may have been sent by fax, so the pharmacy may have to check their fax machine to fill the order. Please ask the pharmacy to check their fax machine if they say they have not received it. Part 2. I sent in your refill, but we haven't seen you in a really long time, so when you get a chance, could you please set up a time to do a medication review? Press 1 to repeat this information. Press 2 to confirm you have heard. Do you wish to start a new session with the provider for another issue? Press 1 for yes. Press 2. Thank you for calling. Goodbye.
Okay, super. So you get your CallMyDoc number or numbers, probably a minimum of 2 for after hours and during the day. But as I said, you can have as many as you want. You forward your calls to it. When the calls come in on your app, you know who's calling, what they're calling about. You're not going to get a complete surprise out of the blue in the middle of nowhere. You get a summary of what's been happening with the patient lately, and you can use the app to call the patient back. You can call the patient back with the one-touch button, or the app can call the patient, whatever you'd like it to do. And now this piece here is what we call the admin portal. Now, before I go into Athena, I'm just going to put a note here. Let's say I work for you, and I'm just helping to answer phone calls. I'm doing that for a reason, because everything on our dashboard here is synchronized with patient cases in Athena. So let me start the login process over here. What's going to happen is this is going to be in the patient case. That's going to be in the patient case. The actions I took while I was on call is going to be in the patient case. And all of this detail, what number did they call from, what date of birth did they put in, et cetera, et cetera, et cetera. I got notified. I clicked on take session, did a call with the patient, wrote a prescription refill for Tazarac, had the app call back and tell them this, hit close session, about 3 minutes. Everything here is eventually also going to be on the chart as well in terms of the full documentation. So if I take that patient case ID out of the session log, I can put it into Athena. And this will bring us right to that patient case so that we don't have to search for it. Okay, so here's a note. Now, the thing is, I didn't have to do that. I'm just pointing out that everything here and here is synchronized. So you can completely work things from this side if you want. You can work them from this side. You can work them from both sides. It doesn't really matter. And I don't think there's like a hard and fast rule I've ever seen in the years I've been doing this where there's a specific method. People just do it the way that they want to run their business. And that's how it normally goes. Now, as I mentioned before, every phone number can be programmed to understand how to transcribe messages after hours or during the day, or however you want it set up into those different patient case types. So you can have a phone number or multiple phone numbers or whatever makes sense to how you want to run your business for you set up to handle those different patient case and question types. As I mentioned before, we're always going to take the patient's callback number down or the callback number of whoever's calling because you never know. They could be calling from some other number. They could be calling from something that has nothing to do with a chart. It happens a lot, which is why we always take it down. Now, this here tells you where it came from. So in other words, if this phone number said Torrance Memorial Emergency Room, you'd see that on the app. You'd see it in the patient case. If this phone number said refill hotline, et cetera, I'll show you some other examples. That's going to be there too. This is just a unique identifier for every call we've done to date. So as I mentioned, we're over 14 million. And if this question was about billing or about who knows what, okay, since you can decide which calls go to the app and which ones don't, or which calls go to who's different first people's apps, et cetera, maybe it's just there in a patient case, just to be worked on when somebody comes in the next day or Monday. But because we worked on it from the app, what we did is here, et cetera, et cetera, et cetera. And then there's a note down here. Okay. So let's just say that I call that patient, I schedule him for an appointment. Okay. What that's going to do is it's the same thing as if I clicked on archive. So I can either archive the call from the CallMyDoc side, or I can close it from the Athena side. Either one of those events means we're done, and put all the documentation back on the patient's chart. Under other documents, phone message, and here you go. So it summarizes what happened, and then it has extreme detail below that. So you always know what's going on or what occurred. So you cannot yet attach a voicemail to a patient chart in Athena, but if I click on view original image, all these blue lines are hot links to the original recordings. So even, which we keep all this information forever. So even a few years from now, whenever, you're always going to know what happened in the past. So what you wind up with is something like this, which is a dashboard showing you of everything that's going on 24 hours a day, 7 days a week. Or in other words, this is all the stuff a live person couldn't answer. So when I look at this, and this isn't rocket science to figure out what needs to be done here. This is just taking an existing feature workflow you currently have today called patient cases and enhancing it and integrating it with the phone system to make everything extremely streamlined. As I mentioned before, we also support other languages. I don't know what that is. But here's the key. We track everything to the nth degree. So in other words, this site here has 750 providers in Florida. Most of the calls are coming in on Monday. That's pretty typical, right? These are the ages of the people that are calling into the system. We're currently handling over the last 30 days, 17,000 plus calls, 18,000 calls. Again, here's the key thing. If you add up these bars, they're generally bigger than these bars. Now, these bars could be people who call in and say, hey, I need a refill, click and hang the phone up, because we can't force people always to do the right thing. However, in general, 8 hours response time. So what I'd like to do here for a second is I'd like to focus on daytime. So now we've talked about what's happening after hours and how the app documents itself, puts everything back on the chart, allows everybody involved, the providers on call and the staff, to have a way less stressful time of dealing with things than they used to. This is how it takes the pressure off during the day and allows you to prioritize which calls go to a live person, which calls can get transcribed for a callback, etc. Come on. Oh, there we go. Okay. So here's how this works during the day. This green part is your phone system. So the CallMyDoc numbers are behind your phone system. You don't have to give those out to people. You can, if you want to, for different reasons, that where you want the patient to call the phone number directly and leave a message for who knows what. But this is just an example. On this site happens to be OBGYN site in Connecticut with 27 providers, but it doesn't matter. It's the same concept, the same idea across the boards. Purple piece is Athena, and the blue piece in the middle is CallMyDoc. And so it's, again, bridging between the phone system and the charts. Now, and this is what their phone system says. This may have changed. I don't really know, but this is just a transcription of their existing phone system. So they have it set up like a lot of people do. Press 1 for this, press 2 for that, press 3 for whatever. In this case, they have multiple CallMyDoc numbers. Now, there's two things happening here. One of which is they're using the CallMyDoc phone numbers as a backup to people. Okay, so they're supposed to have at least 5 people at the front desk. But maybe today they only have 3 for reasons that I don't really need to explain. Everybody's experienced that. So what happens here, if we call this site now and I press 1, the phone system's going to ring the front desk extensions, the front desk phones, because what we're doing is we're taking advantage of a feature that's in every single phone system on the planet. It was actually invented in 1987 called selective call forwarding, which is really a simple term for what should the phone system do instead of sending stuff to voicemail. Well, the phone system, every phone system has the ability to send the call to a live operator. So these phone numbers to the phone system look like live operators or call centers or whatever you want to refer to them as. Phone system doesn't care at all. It just says, is this a real number? And since these are just regular old phone numbers, boom, it just works. So what will happen here is if I press 1, after a certain number of rings that you can set up in the phone system, or if all of the front desk people are busy, the phone system says, oh, send the call here. CallMyDoc kicks in and says, press 1 if you're an established patient, 2 if you're a new patient, or whatever you want it to say, creates a patient case, and then that patient case is routed by Athena automatically into the right inbox. And the same thing for lab results in this, because they want to get as many appointments booked as possible, because if you want to make as much money as possible, you need to book as many appointments as possible. So they have their people focused on the two most important things that for their business: booking appointments and telling people about their lab results so they know if they're pregnant or not. What a lot of people will do, and what they're doing, is because our transcriptions are so accurate, anything that can wait, we transcribe 100% of those calls. So in this idea here is that the most important stuff's getting answered right away, if it can. If not, then it goes to Call My Doc, and the stuff that can wait is over here. So if we just go check that site out real quickly here for a second. So this is that site live in Connecticut right now. You can see here, pretty simple to figure out what's going on and what needs to be done first. But here's the key. If I click on metrics, a couple things you're going to see here. First of all, obviously these are the ages. So we're handling about 3,000 calls a month. So in other words, out of all the calls where a person couldn't pick up, or all the calls that went straight to Call My Doc, it's about 3,000 a month. And they're able to keep up with those calls, the bulk of them in less than 8 hours, averaging 2-hour callback time. Here's the kicker right here, okay? Well, this is something else that we keep track of. Here's what this means. This means that at 10 o'clock in the morning, on average over the past 30 days, they get 320 phone calls per hour at 10 a.m. This also means that right in when they open, they get average 160 calls per hour at 9 o'clock in the morning. Now, nobody's going to staff to those kinds of numbers. It's never going to happen. But because they have Call My Doc taking this information down, transcribing it, figuring out who the patient is, et cetera, they're still able to manage that kind of workload without having to deal with tens or hundreds or thousands of voicemails a month. It's that simple. So when you're on call, you're using the app. You have the ability to filter things out. Another thing that people are using the app for is if the staff needs to work remotely for some reason due to a snowstorm or they can't get to the office or whatever, staff can also use the app to deal with phone calls when they're not in the office. As I mentioned before, you can have as many phone numbers as you want, and each phone number can be programmed to handle calls in a variety of different ways, depending on how you want to run things. You get a summary of everything that's happening. So the best way to think about this is it's like visual voicemail for patients connected to your charts and always managing and monitoring what's going on. Through the metrics function, you can see what's happening. And this everything a person can't get to is listed out here. So these are literally the ages of people calling in. I mentioned before, scheduling is always huge. But you have an idea what's going on. This also, what happens is when you run this for a while, you get a lot of information that you didn't even know existed before about how their phones are behaving in your practice. And this helps you to also to tune up your practice to make things more efficient and decide if you want which calls should wait and just go to Call My Doc and which ones need to be answered right away. And here's how this works. Extremely simple. We don't do one-time charges of any kind. We work with practices of any size from one provider up to 750. It's the same. You get a minimum of 30 days to try it out for free. And if you were to add on in the future, let's say you started with during the day and you add on after hours later, or if you have after hours and you add on during the day, we don't charge for any setup fees of any kind, customization period. And at the end of the day, if you decide to keep it, and the reason why we do it this way is because 99% of the people do keep it once they've started using it. It's $129 for the first provider, $49 for additional provider, month to month, no long-term contract, cancel anytime, and that's it. It's extremely simple, and we've been doing this for hundreds of sites. So let me do my best to try to catch up to what we're doing here with questions, okay? Oh, here we go. Okay, so question is, what if your phone system is down? Will CallMyDoc still work? CallMyDoc works all the time. Here's how CallMyDoc works. During the pandemic, we were way up to like 800,000 plus calls a month. CallMyDoc never stops working. So in actuality, CallMyDoc can be actually more reliable than your phone system. Also, CallMyDoc is actually capable of running faster than Athenahealth as well. And CallMyDoc knows in a millisecond if there's a problem with Athenahealth. So the answer to your question is CallMyDoc works no matter what happens, always, period. Yes, as we talked about, you can use it for daytime. You can use it for after hours. I mean, think of it this way. What do you want to fix first? And then you can add on additional pieces as we go along. And setting that up and customizing it the way you want doesn't cost any extra. So it works great after hours. I could show you a lot of different examples of after hours for any practice type. It works great during the day. I can show you lots of different practices that are using it during the day. And also, the reason why we do this and we went to this sort of a pricing scheme is because we're in so many locations across the country. And how people run their phones is not exactly the same from practice to practice. So you could have two primary care practices in the same town, and the way they're doing their phone systems could be completely different. This gives you total flexibility. This is focused on your business and how you want to run it, which is why we do things the way that we're doing. So don't worry about if we could do something. Just say to us, I wanted to do this. Yes, here's the fun part about our languages. So if you're on call and a patient calls you in Spanish, you're going to see everything they're talking about written in English, nearly perfect. If you use the app to call the patient back, so another thing the app can do is we can do outbound calling too. So if I use this app to call the patient back with the automated functions, it's going to transcribe it back from English into Spanish or Arabic or whatever they call them to give them their instructions. The only part of this that doesn't yet do what we'd like it to do, but it will at some point, is real-time transcription of what you're saying as you're talking from English into Arabic or Spanish or some other language when it goes to the patient. It will do that at some point. It just doesn't do it today. You can have a mixture of providers that are using the app and providers that are not part of your practice. And CallMyDoc is great at running the entire on-call schedule. Okay. The only thing is it can be somewhat funky because the problem is you have to differentiate between which callers are callers that are connected to the app and connected to Athenahealth and which callers aren't. So it works fine. It doesn't have any issues, but it can be slightly funky to the patients. I've noticed in that past. If the person does not have a chart in Athenahealth, you have a couple of choices there. Typically what we would do is we have a feature we could turn on which generates a fake patient chart. In other words, in Athenahealth, to create a patient case, you must have a date of birth. So when we turn that feature on, it creates a fake chart with a date of birth of 9/9/1901. It specifically says, CallMyDoc, do not touch or delete. and then we could push patient cases over. And then what can happen is that when that patient case comes in, you can use CallMyDoc features to map it to a specific chart if you want. We can mix and match so many different things after hours. We could allow you to put in, if you want, you could put in some sort of live answering service. So let me just see if I can find these guys. Center City Pediatrics. Here we go. Okay, this is a pediatric site, but here's the point. Okay, from 8 to 10:30, Dr. Madani's on tonight. From 10:30 to 8 tomorrow, it's an answering service with a nurse triage line. And so what you do is you just set them up as another on-call scheduling resource, and you can literally do anything you want around that. And you can do some really creative things with how that works. Yes. Your routing calls, your public phone number is over here. So you're routing calls based on your phone system. And by the way, setting this up on the phone system takes 2 seconds. So it doesn't really matter what kind of phone system you have. These are just phone numbers. There's no rocket science behind this. In other words, it's just a matter of saying, okay, I want these calls to only go to CallMyDoc if someone can't answer. I want these calls to always go to CallMyDoc because I want it to transcribe everything. Sorry, here we go. You could mix and match which sites use this, which sites don't use this. Let me show you some interesting ideas too here for 2 seconds, okay? Aspire, Indiana has 87 providers, okay? Currently, we do three major things for them: lab results, medical records, and all refills. Now, when it comes to the lab results, the reason why we're doing this is because it was too overwhelming for them. When the different home health kits came out for testing COVID and all these other things, they wanted to make sure that everything was tracked. They wanted to make sure that everything was getting done correctly. And 100%, when you call Aspire, someplace on their phone system, it says press, 4 for lab results, is going to 100% of them are going to go here. 100% of the medical record requests go here. And again, this isn't necessarily a full-time job. So they have it set so that all the calls go here, and they have somebody dedicated to check these patient cases and take care of them as they come in. And then 100% of the refill requests also are going here because they want to know that everything's getting correctly, is being tracked, and they're handling the refill requests pretty quickly. This one here in particular, or some of these other ones, again, it could be patient called in and said, "Hey, I need a refill," and then hung the phone up. I mean, you can't control how people are, but in general, extremely efficient callback time on that. I don't know if I've answered all your questions, but I hope so. I do appreciate everybody who attended this, and it's just a very simple thing. The biggest thing is you just need to fill out the form, the consent form. And the only thing this costs you is your time to investigate how this is going to work for your practice. But because of our level of confidence and our popularity as being one of the top 10 most popular apps on Athena, we know it's going to work out, which is why we'd love to work with you to see how we can help fix your phone problems and phone systems. And if you have any questions, just get in contact with us and we'll take care of it as soon as we can. Okay? I'd like to thank everybody for attending and have a great day.